So again, I'm too dumb to look at the little tiny pieces, so I'm gonna give you my view of what happened. DC said, we're gonna give free health care out. We used to subsidize in the emergency rooms within TALA. We're gonna pull those subsidies away, and we're now gonna do it by giving you your Medicaid taxes back. When we do that, we're always gonna make the same assumption, just like if you ran a free buffet. Before it was free, Jimmy ate 2 hamburgers, and we're gonna say, now that it's free, Jimmy can probably only stuff down 1 more hamburger. It never works that way. Jimmy brings a suitcase and sticks 500 hamburgers in the suitcase, and somehow Jimmy goes from when he had to pay buying 2 hamburgers to now having 502 hamburgers, and we're stunned that it's 50% increases or 100% increases or whatever it is. So the reality is that was put in motion by Washington, D.C. nationwide. We cannot control it. The second thing they did was they said insurance companies will not be allowed to profit from this because we're going to make a new law which says however much they collect, they must spend 80% or 85%, whatever the number is, and the profit is limited. So an insurance company could raise the rate 50%, 90%, 100%, and their profit margins are not allowed to expand legally. So even the incentive, as greedy as they are, none of the rest of us are greedy, just them. But as greedy as they are, unlike the rest of us, that won't work for them. And the reason it won't work is because the same law that said it's all going to be free also said you can't raise your margins. So here's my biggest concern. If we go to Washington and we tell them, look, even though it costs 50% more in Texas, 50% more in Mississippi, 50% more in Tennessee, we've got some magic pixie dust in Arkansas where we can do all this for only 10% more. And I now promise you, Washington, because our private option reimbursement rates are based on annual changes off of a base rate, that we can somehow magically do in little old Arkansas, but they can't do in Texas, they can't do in Mississippi, they can't do in Tennessee, they can't do it anywhere else, but just here we have magic pixie dust, that it's going to blow up in our faces, and 3 years from now or 2 years from now, we're all going to be looking at each other wondering how we got here. So are we setting ourselves up for that with the Washington, D.C. commitments? Because if we are, is there any way that we can undo that? Because I fear it could be really challenging.
Well, there's a lot of stuff in there. None of these companies, if they could get to 80%, they'd be tickled to death. Okay, a lot of them are tracking at 90, 95. Because of that, a lot of these companies are pulling out of these other states. I'm going to be more concerned about having someone to offer insurance in Arkansas. If they can't make a profit, they're going to pull out of that particular market. United Healthcare already has. So to think that it won't happen here is, it would be irresponsible. But